Okay, guys, so I just wanted to come to you and give you an update after I met with Dr. Roski at Cleveland Clinic. Um, he referred me to Dr. Dakwar, which is a neurosurgeon at Cleveland Clinic, and he told me that even though I'm 8 months post-op lumbar fusion, I have not fused at all. There's actually no bone growth coming from the cage. Nothing has fused. So basically, failed fusion. Um, He informed me that he'd like to wait till I make 1 year from the date of surgery in order to go in there and revise the surgery. So that would be January 2020. And in the meantime, my pain would just get worse and worse and worse. And there was a probability that the screws will start falling out because there is no stabilization in my back because there's no fusion. So I asked him, well, okay, so I understand that I'm going to need a revision surgery. I'm not happy about that. But also not happy about having to deal with the ridiculous pain that I'm in until January. It is September. That's several months. So he suggested that I get a spinal cord stimulator put in, and that would be another surgery. So he told me to go home and think about it. So I left kind of sad. I knew something was very wrong with my back. Didn't know that I didn't fuse. Yeah, so that's what he told me. So I went home, I thought about it, and I was saying, I really don't want to have a spinal cord stimulator put in. I watched some YouTube videos and Googled it, and it's surgery. They still have to cut me and put things in. And on top of that, I would have to go through the trial period where the device is placed outside of my body and kind of taped to me for a few days to see if it works. And then if it works, they put a permanent one in. So I would have to do all that, and then in January have a third surgery because I've already had a lumbar, have a third surgery and get the revision done. So I just decided to research some top doctors in South Florida, and was just doing some research. I found a Dr. Wang in the University of Miami, and I was thinking about going with him. So I sent my information to them, and I was waiting on a call back. But in the meantime, the doctor that I had seen, the orthopedic spine surgeon that I had seen at Spine and Ortho in Coral Springs, Florida, when he saw me, he told me he couldn't help me, that he really didn't know what else that he could do for me because he didn't see anything significantly wrong, even though I was telling him everything that's been going on with me. And, he said, well, maybe you should see my colleague, Dr. Sahai. He specializes in complex surgeries and he specializes in revisions. So I said, okay. So I kept the appointment and I saw him yesterday in Deerfield Beach. His name is Dr. Sahai. He is a board certified orthopedic surgeon. He does specialize in revisions and complex spine surgeries and he has a lot of specialties. So I met with him. He looked at everything. I mean, his assistant, I've never been questioned about my condition and my symptoms like that ever before. His assistant covered everything. She asked me everything. She took her time. She wrote down everything. And then Dr. Sahai came in, very nice, very personable, great bedside manner. He spoke with me. He basically looked at my images and he turned to me and he gave me this kind of like, yeah, that smell. So I already knew something was very wrong. So he did tell me exactly what the other doctors have told me. In 8 months, I have not fused at all. But he then told me things that I have not been told before. He told me, if you have not fused at 8 months, you are not going to fuse. You need a revision as soon as possible because, the screws are going to start loosening and possibly falling out. That's the first thing. Number 2, the cage that was put in was way too big. So he has to take that on and put a new one in. Number 3, they took too much bone from another vertebrae, and it's kind of not giving the other vertebrae enough room to move around. I don't know if I'm explaining that correctly, but yeah, so he said you need a revision as soon as possible. And unfortunately, because you had a TLIF and they went in through the back. I cannot go in through the back now because you have a lot of scar tissue and the cage is in the way. So I have to do an ALIF where I have to go in through the front. Was not excited about this. I've had 3 children. Naturally, I've never had to have a C-section, and now I am going to have some type of C-section looking scar in the front of my stomach. I know that's not super important to a lot of people, but at least when I had the TLIF, I had all my pain in my back. Now I'm gonna have pain in my back, in my front. I'm just gonna be a miserable wench, basically worse than I am now. So my surgery is Monday. It is now Wednesday, September 11th, and my surgery is Monday. So today I had to run and get blood work, chest x-ray, EKG, and if all the blood work and the chest x-ray looks good, Friday I have my pre-op appointment where they go over the surgery again with me, fit me for a brace, and tell me, when to come in for surgery Monday morning. It's a lot. I'm in a lot of pain, guys. I'm not sleeping well. I'm just ready to be done with this pain, and I'm hoping that this surgery goes well. I need all the prayers I can get, and hopefully things will turn out better than they did the first time. By the way, every doctor that I see has nothing but bad things to say about Laser Spine Institute, how they have messed so many people's lives up with the botched surgeries they have done. The surgeon actually told me that he used to be called all the time from Laser Spine Institute being asked to testify, and he refused every time. He said he did this because he knew they were up to no good. He also says he gets at least a minimum of 2 patients a month from Laser Spine needing revisions. So he was very empathetic, very kind, very knowledgeable. He explained everything. I think things will be good. And so I'm going to pray a lot. Pray for me, please. And I will keep you guys posted as best I can. Okay? Thank you.